Today, we're going to talk about bone density. So, Western medicine says that if you have osteopenia, which is the early sign of bone density loss, or if you have osteoporosis, which is frank loss of bone density, then you're at very high risk of a sudden fracture. So, whether a spontaneous fracture, which means you're just walking down the street and poof, something breaks, or you fall down and your wrist breaks and your hip breaks. If you develop a fracture like this, the chance of you recovering from this is very low. So, what are you supposed to do? Western medicine tends to create a little bit of fear in us that if you have any bone density issues, you have to take all these strong medications and there's nothing you can really do about it. And that if you do exercises or change your diet around, your bone density scans really won't change. And it is true because Western medicine is bases its decisions on the bone density scan. But I don't think a bone density scan is as effective as other tools that we have. As a health coach, I approach things a little bit differently in the sense that I ask, okay, what is it you're doing already? And what is it you're not doing that you think you should be doing or you could be doing? And wait for a minute because you'll understand why this is so important. Western medicine approaches it differently. They don't really ask what it is you're doing or you're not doing. Sure, they take a few risk factors into account, but really what they're doing is taking a scan, a test. Based on that scan and test, they're going to say what your risk is and whether you need to be on Prolia, Fosamax, or calcium and vitamin D, or drink a gallon of milk every day. Um, and it's fine. It's fine to approach it that way. If you're somebody who believes in Western medicine strongly, you've had really good success with it, you've seen it in your family and friends, then that is just one approach. Another approach might be to say, well, we know what leads to lower bone density. We know what leads to fractures, and we know who tends to not recover well after a fracture. And these are the people who don't have very good balance, so they fall easily. Their bone is frail and they tend to take a long time to recover. Maybe their diet is not optimized. Maybe their mental state is not that good. Their nutrition status is not good. Maybe they carry a lot of extra weight without a lot of muscle. For those individuals, the question is, what is it you're eating? What is it you're doing? If you're doing the right stuff, if you're eating the right stuff, the chance that you're going to get any benefit from one medication is incredibly low. If you're not doing the right stuff from a health coaching perspective, I would say, great, let's focus on those things. I'm going to help you think about what's important to preserve your bone, to have strong bone, and to recover quickly. And probably the most important thing, to prevent a fall in the first place, right? Because no one's really going to wake up and suddenly break their spine or break their hip. That's unlikely. Those are not common things. What's more likely to happen is that you didn't have the balance. You didn't have the good proprioception. You couldn't see things well. You couldn't react quickly. You couldn't hold yourself up. And then you suffer a fall. That fall then can lead to a fracture. I'm here in beautiful Bend, Oregon. So you're probably going to hear a lot of wind and background noise, but I hope it's lovely and beautiful. If it was a patient of mine in Western medicine, that is exactly how I would treat them because the protocols that dictate Western medicine are pretty straightforward. If somebody comes in, you do a bone density test. There are some other tests that you can do, but based on that, you assess somebody's risk. In my health coaching practice, I approach it differently. We start talking about habits, lifestyle changes, activity modifications, and oftentimes what I hear is, I already exercise, so there's not a lot else I can do. I eat a lot of protein, so there's not a lot I can do. Well, your diet is certainly important because we want to keep as much of the vitamin D and calcium in your body as possible. We want to also prevent it from getting depleted with too much salt intake, too much alcohol intake, too much caffeine intake. Those things can also force you to lose your calcium quickly or prevent it from getting absorbed into the bone. And somebody might say, hey, Dr. Mo, Dr. Ashori, hey, I exercise really well. I do a lot of really good activities every single day. Well, that's good, But not every somebody saying like I exercise is like saying I eat, right? Or I eat well. Or what do you eat? We need to know the details. So the particular exercise that you need to build bone, to strengthen bone, is very different than just any old exercise. And that's another thing to pay attention to. So with all that said, what can you do? What are some changes that you can make? Like I already talked about, don't do things that will deplete your body of excess calcium and vitamin D. In this day and age, we have ChatGPT, we have some brilliant AI-based algorithms that can help you research that topic. How do I prevent losing too much calcium or vitamin D in my body? Things I already mentioned: alcohol, caffeine, and dehydration. Certain minerals that you might eat too much, not getting enough sunlight. Of course, those are risk factors. When it comes to exercise, maybe if you're getting some good cardio or you're going for walks, that's good. But what kind of resistance stuff can you do that actually puts your bones in tension? So if this is your bone, it tenses it in different directions, right? That's kind of the goal of these kind of exercises, to really put your body into these different tough motions. Certainly yoga, Pilates can do that. Weightlifting can do that. But if you're kind of only accustomed to a very limited set of exercises for weightlifting, it's good to vary it up. And rock climbing, of course, is great because you're certainly putting your body in some very difficult tension moves, which can be incredible for bone strength. So I hope this is of value to you. Once the wit here, I'll end this. If you have any questions, you can email me, hello, at drashori.com. Go to my website at drashori.com.